Statins are the #1 selling class of drugs ever. Pharma companies sold 1 trillion of these globally and about 400 billion in the United States. The tough part is it's all a lie. Statins are very dangerous. You go to your doctor and he tells you that you have high LDL cholesterol. That's the bad cholesterol. 9 out of 10 of you are going to walk out of that doctor's office with a prescription for a statin. So how do they work? Statins work by getting in the way of your normal liver function to produce cholesterol. Current mindset by clinicians is to downshift everyone's LDL by going to a low-fat diet and putting them on statins. Well, that's just what they were trained to do in medical school. Medical schools are primarily funded by drug companies, so it makes sense that that's the advice they would learn in medical school. One irony is this COURAGE study was meant to prove that statins were ideal compared to like a PCI intervention, like a stent. They're looking for ways to increase your life. In this proof that the optimal statin is a better solution than a stent, they used one of the criteria of interventions to have your LDL lower than 85. And those that actually achieved that result had a 3% higher death rate than those who were not able to have the goal of getting below 85 for LDL. And get this, with or without a statin, the risk of a heart attack remains exactly the same. Conversely, up to 20% of statin users have some kind of side effect, some of them very serious. Side effects include muscle breakdown, kidney failure, type 2 diabetes, and the last realization is that being on a statin increases your level of insulin. Being on a statin can actually have a side effect of becoming a type 2 diabetic. To me, is by far the most alarming. Other data on statins and heart attack risk are industry generated, and they conclude that the median life expectancy increase for being on statins most of your adult life is that you may live 4 days longer. How do we get off of this ride? The #1 risk factor for heart disease is not high LDL. It's the insulin resistance of metabolic syndrome. Triglycerides are a better marker than LDL cholesterol. In fact, the largest study of heart attack risk revealed that 66% of heart attack victims were insulin resistant. When you take a statin, you're increasing your chances of becoming insulin resistant.